That was on the quiz, so we're just having it on 20 and 21. So 21 is basically the blood vessels and circulation, right? Now we will be doing blood pressures, right? Hopefully next week. The problem with it is, right away I can tell this is not what you should ever do. When you do blood pressures like this, you should never put your thumb on the actual part right here, because your thumb actually has a pulse that you can actually auscultate and get it confused. And there's a nice pink stethoscope, but still, right? Yeah, you should put your thumb there, right? Functions of the circulatory system, obviously we kind of understand it carries blood. It allows us to have nutrient exchange, exchange of waste, exchange of gases. Transports hormones and components of the immune system and blood clotting, right? So it transports everything that we can imagine. Now, the thing about a circulatory system are the ones that I kind of highlight there that is a little bit, we're gonna focus in on this chapter, right? Regulating blood pressure and directing certain blood flow. Because remember, think about it from this kind of, I want you to think about it in two ways. One, right, I want you to think about it in the way that we have parasympathetic and sympathetic output. When we have parasympathetic output, what do we need? How do we move to those regions? Remember, parasympathetic is rest and digest. So part of it is digestion. So we need to bring blood to the areas where we have digestion, GI tract. And on one other thing is, most people don't realize it, but part of rest and digest and the rest part is actually bringing more blood to the urinary system as well. That's why when you're really busy at work, sometimes you don't even feel the urge to go to the bathroom. Then you get home, and then you have to pee every 2 minutes, right? So that does happen, right? Because when you rest, you bring blood flow through every area of your abdomen, including your urinary system. All right, blood vessels.
By the way, I don't know if it's recording.
It should be. I think I see it. Yep.
Okay.
Yeah, I have it now on this thing, so it's. I've had the iWatch for like 8 months. I had no idea I can do that until a week and a half ago. Now I can see what it's actually recording. I'm like, wow, it's pretty neat. So, in terms of arteries, arteries carry blood away from the heart. Arteries away, A and A, right? So, when we think about it that way, even the pulmonary artery kind of makes sense. Because a pulmonary artery, even though it's a vein, is carrying blood away, right? Arterials are small arteries that connects to even smaller capillaries. Remember, when blood is moving through the large arteries, blood is moving so fast, under so much pressure, that there's no way you can have any gas or nutrient exchange. So as blood's going through the aorta, it's pressurized and there's a lot of it. So there's no way you can have nutrient exchange there. So what we need for any kind of gas and nutrient exchange is to divide everything up, split the arteries into ever smaller arteries, and then smaller arterioles, and then the arterioles will split into capillaries, where everything slows down into single file line. Right? Now capillaries are where we see the site of gas exchange and nutrient exchange. As long as you have a capillary, there's a possibility of nutrient exchange. All right, once we go through the capillaries are connected on one side to the arterioles, and the other side to the venules. Remember, it's one big complete unit, where arteries bring it out, eventually to capillaries. The capillaries then will connect to veins, which brings it back. So it's a kind of a closed unit here. The venules then, right, drain to larger veins, and these larger veins will then carry blood back to the heart. Now, the weird thing is this, vasa vasorum. What is it? Vasa vasorum are blood vessels for the blood vessels, right? You would imagine, like in the, the aorta, right? It's pretty thick. It's got a lot of muscle. It's got a lot of elastic tissue. It's got a lot of cells. You need to bring nutrients to those cells. So the blood that's going through it is going too fast, under too much pressure for any nutrient exchange. So if we didn't have the vasa vasorum, those cells that make up the aorta, they will die. So we need the vasa vasorum to actually bring blood to those arteries. which is kind of weird to think about. In terms of the structural component, so here's a capillary right here. Capillaries are nothing more than the inside of an artery or vein. We're going to see, right here. The inside, so in terms of a large artery and vein, it's got three main layers. You get an external tunica externa, a very thick tunica media, and then a very close, very small tunica intima. So tunica intima is basically just simple squamous epithelial cells and a little bit of basement membrane holding it together. Well, that's a capillary. So capillaries are basically the simple squamous cells, nice and flat and squished, right? And that's it. It's got a little bit of basement membrane holding it together, but that is it. Why is it important to have simple squamous cells? Because they're squished, they're flat. Because they're flat, oxygen from the red blood cells can get out. Carbon dioxide from your tissues can get in. There's no barrier. The thicker the cell, if you have simple cuboidal cell, well, the cell will be too big, right? The fusion of the gases will be much harder to go through. So the actual flatness of the simple squamous cell makes it very important. Now what else, right? Things like fats and gases goes right through these cells without any help. Other things do need help, like proteins, even glucose needs a little bit of help to go from your cardiovascular system to the tissues it supplies. Remember, you never ever have red blood cells actually going and entering the tissues and then draining into those tissues. There's never any direct contact with the red blood cell. There's always a capillary in the way. So when we have even gas exchange, there's always the red blood cells trapped in the capillary as they kind of circulate around that target tissue, right? So here's a picture of the capillary. Look at how small it is, right? It's so small and thin that red blood cells have to go single file to go through the capillary. All so then you can increase the transit time, meaning that you make it harder to go from one side to the other. You give time for each red blood cell, you give it time to release oxygen to the tissues. If it's going super fast, well, you're not giving time for each red blood cell to release oxygen. You're just pushing them all the way through quickly. They're found near, right, every cell in the body, highly extensive in highly active tissue. Kind of makes sense. Your skeletal muscles, very vascular, right? The brain, very vascular, because it's so highly active. Function is for nutrient exchange and waste exchange between blood and the target tissue. Capillary wall is composed of a single layer of simple squamous cells, we call endothelium, and a basement membrane. Now we're going to see in the next slide. There's a lot on the next slide I want you to know. Right here, right? Now, with these right here, know the differences. All right, there's continuous, fenestrated, sinusoidal, and sinusoids. What it is it goes from top to bottom. The top one, the continuous one, basically very impermeable to things, right? You actually limit even water movement out of these capillaries. The bottom one, the sinusoids and the sinusoidal ones, right, you let things in and out much more readily. There are big gaps that are found whether in the cell or between the cells. So let's take a look at continuous capillaries. Continuous capillaries are continuous, no gaps, right? So those cells are very close together. There's no gaps that are found between those cells. Why is this important? It limits things getting in and out of the bloodstream. So then proteins, polypeptides, right? Nothing can get through, even water can't get through. So usually, especially in the nervous system, you even have tight junctions connecting it. So then nothing gets through, right? Again, water in the brain is a life-threatening condition, all right? It can cause you to herniate the brainstem. So cerebral edema is bad, and we have to limit water movement there. The next type are fenestrated capillaries. In fenestrated capillaries, right, they're tiny openings inside the endothelial cell. So there are tiny cracks between the cells, and then inside the cell, there's actually tiny openings, tiny little windows, right? Those windows are called fenestrae. These are areas where cytoplasm is absent and the plasma membrane is porous, allowing small molecules to get through. Small to medium molecules, like a dipeptide, a tripeptide, can go through. Amino acids can go from one side to the next, right? So we see it in the intestines. So we can absorb amino acids, right? So you have cells there, and then you somehow have to bring the nutrients you absorb into your bloodstream. Well, we have little openings in the bloodstream there, in the capillaries of the in the capillaries of the villi, capillaries of the small intestines, right? Those capillaries have tiny gaps, allowing larger molecules to get through. So the first one, continuous, nothing gets through, not even water, right? Second one, we allow small molecules to pass either between the cells or even through the cells internally. The next one, right? And now I want you to think about this, all right? If we make cells in the bone marrow, how do we introduce it into the bloodstream? Because the bone marrow, you're gonna make the cells, it's useless unless you put it into the bloodstream, right? So how do we introduce whole cells or even proteins into the bloodstream? Well, we can't have continuous capillaries in those organs. So when we have things that are larger, right? Now, best example for the sinusoidal ones are something like your thyroid hormone. Your thyroid hormone is a big protein, right? They're produced by the thyroid gland. As the thyroid gland produces it, you have to introduce it into the bloodstream somehow. How do we introduce it? The capillaries found in the thyroid contains larger gaps, right? Between the cells, much larger gaps. Gaps we call, right, sinusoidal capillaries, and they're big gaps that allows big proteins to be introduced into the bloodstream. And the liver produces albumins. It produces a lot of proteins, a lot of clotting factors as well. Those are all proteins. How do we introduce it when the liver produces it? Well, the liver produces it, and then the capillaries in the liver contains sinusoidal capillaries, where there's a large gap between the cells. It allows you to introduce proteins there. Perfect. Now we can have albumins in your bloodstream. Now we can have clotting factors in your bloodstream. Now we can have, right, thyroid hormone in your bloodstream. Now, the last one is where we have whole cells, right? So you have a red blood cell being produced at a rate of 2 million per second in the bone marrow. If you're making it, you need to somehow put it and introduce it into the bloodstream. The capillaries in the bone marrow has even larger, right, gaps in there. And not only do they have large gaps, there's no basement membrane, meaning that there's no way you can retard that movement. You can't stop that movement. Perfect, right? Now we can introduce whole cells into the bloodstream, and now white blood cells get introduced from the bloodstream in the bone marrow, and then red blood cells get introduced because they have these type of capillaries. Right? In the spleen, where we're getting rid of red blood cells, right? We need to somehow kind of evacuate them out. Well, the capillaries there are also sinusoids. So the larger the gaps, the larger the molecules you can remove or introduce, right? So keep that in mind when you're looking at this. These are really good for like either a multiple choice or a matching question, right? Right? Now, next are these capillaries right here, capillary network. So arterioles will lead into capillary networks, right? So the arterioles lead to a blood vessel called a metarteriole that will then lead to these, right, capillary beds, we call them. Now the capillary beds will, to open them up, you have little tiny, right, sphincters here. Those sphincters, they look like little rubber bands, right? And what they do is that they can detour blood or they can accept blood. What do I mean? Let's say I'm working out. If I'm working out, I want more blood to go to the skeletal muscles, right? So the capillaries in my skeletal muscles, those capillaries right here, the sphincters completely relax. As they completely relax, I have greater blood flow into the capillaries. So then I can bring more nutrients to those muscles. But it comes at a cost because you only have so much blood. So what's the cost? Well, when you're working out, you're going to detour blood from your GI and GU tract, right? So what do we do there? Well, in the GI and GU tract, I constrict these sphincters. Because I constrict these sphincters, they don't go through the capillaries. Then they go from one side, the arterial, and they go all the way through to the venial, bypassing the capillary bed. So you don't lose any oxygen, right? You don't lose any nutrients to that area that's not active. But obviously, if you tighten it for a long period of time, that's also not good, right? Because your GI tract needs a little bit of low-level nourishment, even when it's not active. So some of them will be slightly open. So again, with these precapillary sphincters, they regulate blood flow based on activity. The more active the tissue, the more relaxed the sphincters. The less active the tissue, the more constricted the sphincters. The when you constrict the sphincters, you bypass that region. So then there's less nutrient exchange. Right. Arteries and veins both have these three main tunics or layers, right? So we use that tunic and layers and stratas, right? Different words meaning the same thing, right? So tunica or tunics are layers. Going from deep, we have tunica intima, which is basically just like your capillary layer, right? Contains simple squamous epithelial cells with basement membrane surrounding it, maintaining its integrity. Then you have then you have the lamina propria external to it, giving you even greater integrity and structure. Now, in terms of arteries and veins, the thickest layer should be this middle layer. It's called the tunica media. The tunica media for medium, right? I know, right? Is the intermediate layer, and it contains a combination of smooth muscle and elastic connective tissue, right? The smooth muscle allows us to have vasoconstriction or vasodilation. So it is this area right here that allows you to constrict or dilate. Right? Kind of makes sense. That's where the muscles are. Right? In artery, it is this layer that differentiates it from a vein. So I want you guys to take a look at this picture right here. Right away, we should be able to tell which is an artery and which is a vein. Right? Now, arteries, because of the presence of a lot of smooth muscle, always are open. Whether it has blood in it or not, it's always open. Veins collapse when there's no blood in it. And here you can see this collapsed vein. Why? Because veins have very little smooth muscle. So when there's no blood in it, it collapses. When there's blood in it, you're working out. As you're working out, the vein starts to pop out, right? Why does it pop out? It pops out and becomes engorged because you have more blood flow going through that vein. So the more blood flow, the bigger the vein becomes. So the more you activate the muscles there, the more active the muscle, the more blood goes there. The more blood goes through the vein. The larger the vein looks, right? But when there's no blood in the vein, it collapses, right? So just by looking, I mean, obviously it has an A and a V here too, but just by looking, we should be able to tell which one is which. Now, in veins, we have very little amount of smooth muscle. So in terms of veins, we have a harder time constricting and dilating it. There's very little pressure in a vein. So we're gonna see that there are a little bit more difficulty in moving blood in the vein. Anybody has parents that have spider veins or varicose veins, right? I know my mom does. It sucks, right? It's usually the superficial veins. It cosmetically is terrible, right? I don't think I ever saw my mom wear anything but pants, right, in her whole life. Never wore shorts, never wore skirts, because she was so embarrassed because of the varicose veins. And I know she probably loves it that I'm talking about her too, right? So what happens is, right, is the superficial veins that become engorged, right? And what happens, there's no good way of treating it. We can get rid of it, we can stipple it, where, you know, eventually we put like a warm or a hot vessel in there and it kind of causes the vein to die off. But now you don't have any blood flow in that area, right? Before you have some blood flow because you still have a vein, but now you have no blood flow, and now you can even have more edema and more issues, right? So if you don't have parents that have it, good, right? If you do, well, or you do have it, I mean, it's just cosmetic. It sucks, right? It's easier to say when it's not you, when it's a cosmetic, but it does affect certain things. I can imagine not being able to wear shorts in the summer, right? I already don't like the heat too much, so not wearing shorts, I would not be able to tolerate it. All right, so arteries, again, this is just another example of it, contains lots of elastic tissue, and because of it, it has elasticity, allowing arteries to accept blood under great pressure. Example, your aorta. Your aorta is receiving blood under tremendous amount of pressure, right? As it receives blood under that tremendous amount of pressure, it's able to then, right, because it contains lots of elastic tissue, it's able to stretch without ripping. It's not foolproof, and we'll talk about why in a second, all right? Once it's able to stretch, just like a rubber band, right? When it stretches, it wants to come back to its normal shape. Makes it contractile as well. So the more you stretch the aorta, right, as long as there's blood pressure from the ventricle, you can force the blood upwards. But once the ventricular pressure drops, then the aorta wants to snap back to its normal shape. When it does that, it can move blood, right, back towards the heart and away from it as well, right? Now arteries also, because of their smooth muscle, can increase or decrease luminal size and limit bleeding from wounds and shunt blood from one area that's active to other areas that are active, or shunt blood from areas that are inactive to areas that are active. Shunt means detouring. That's all shunts mean. Right? So we have these kind of elastic tissues, the name of them right here, and we'll talk about veins, and then we'll stop. Right? So here, elastic or conducting arteries. So not only do we have names for the capillaries and the different type of capillaries, but we actually have different type of arteries. The good news is, right, I want you to recognize only a few of these, right? Elastic or conducting arteries are the largest diameter vessels. These are high pressure, right? And they are going to, in terms of these arteries right here, it contains